Hello, my name is Alec Burnett. This is my presentation on professionalism and the future marriage and family therapy, just for the law and ethics course here at Alliant. So I was able to interview two licensed marriage family therapists for this assignment. The first person I interviewed was a 32-year-old white heterosexual male. He's a marriage and family therapist in private practice right now. He has about a year and a half of experience, and his main modality is psychodynamic. The second therapist I interviewed is a 38-year-old white heterosexual male, has about 5 years of experience as a marriage and family therapist, and his main modality is the systems theory. Yeah, so I asked them questions regarding some challenges, ethics, cultural awareness, licensing, and just the future of marriage and family therapy. Um, some of the key themes I'm going to talk about are just the importance of self-care as therapists, maintaining confidentiality, recording, being culturally competent, um, just awareness of others, just position as a therapist, um, working with colleagues together, collaboration, and just continued education and licensing. Yeah, so for first question I asked the therapist was just the challenges that they face as an MFT. So yeah, the first therapist, he's only been, yeah, like I mentioned earlier, just a therapist for about a year and a half. So um, he was mentioning just how it can be tough. Sometimes you can't bill insurance when someone misses an appointment, like same day, so you don't get paid. So yeah, it's unfortunate. And he was talking about too, you want to do a productive job as a therapist, but you're having to and make more money, so you're having to think on taking on more clients when you're mentally drained, and just take on more clients can mean longer wait times. So I think he was just at first struggling with that and trying to get the balance of the correct amount of patients and just being able to give them the right amount of time to help them out. You can stretch yourself, and that's why he talked about just the importance of self-care. And we talked about some methods he uses. He journals, plays music, surfs, hikes, and just has solo time in nature. So he has a lot of different outlets to do for self-care. This aligns with just in the issues and ethics in the self-care profession book, just about burnout and self-care. Mentions clinicians who do not engage in self-care practices are at risk of not being able to competently fulfill their professional duties. Yeah, very important to have self-care. And that also just mentions, just stresses the importance of, therapeutic lifestyle changes, um, you know, focus on exercise, diet, time in nature, stress management. So, yeah, what he does aligns with just the importance of, yeah, self-care. And then, too, with the second therapist, so he's also in private practice. He's talking about just the cognitive just load that it has on him, and just kind of sometimes the feeling of just kind of powerlessness. Um, can be hard. You mentioned just hard to recognize kind of the limitations he has as a therapist, and just see if he's really the right person, right fit for the person. So a lot of times he can question his confidence and competence, um, and just trying to manage, self care, and getting burnout, just the work life balance with that. He described he likes to hike, do yoga, journal, has some similar, yeah, has some effective self care techniques that work for him. Next question I asked them was just the role that law and ethics has played in the job. Um, so, yeah, they both mentioned just the importance, being aware of dual relationships. Um, when I was talking, so they both live in Santa Barbara. When I was talking to the second therapist, he mentioned to just um, how he can run into people at social functions a lot. Um, and he just, stressed the importance, just like the ball's in their court in terms of acknowledging that and where to go from there. Um, on his part, he doesn't want to risk, uh, breaching confidentiality with the patient. I know this just aligns with just the AMFT Code of Ethics, just 2.1, just disclosing the limits of confidentiality. Marriage and family therapists have to respect and protect client confidences and avoid any behavior that could inadvertently disclose a therapeutic relationship. Um, and also, too, just looking at just the role of law and ethics. Um, the He mentioned, or both therapists mentioned the importance of the CAMFT legal team that's on staff. Basically described them as like on staff lawyers, but if there's any issues, ethical issues, always best to contact them. They like having that resource. And a big thing is just consulting with colleagues. Um, and when it comes time to, just doing sessions, mentioned the importance of recording. He said, record, record, record. Um, his mentor stressed the importance of recording, to cover yourself. Anything happens, and just make sure that it's, you know, visible and written out, of course. This aligns with just in issues and ethics in the helping profession. Just going back to chapter 5, just practitioners who fail to keep adequate records of their procedures are opening themselves to liability. So, and then it says, accurate record keeping will keep out of legal trouble. And then looking at my next question for the therapist was the influence of cultural awareness and sensitivity on the MFT profession. Um, so the first therapist mentioned just the have awareness of the person. Consider their cultural values. I know he's mentioned he sees a lot of the Latino population, so there can be an emphasis on family and faith. So just kind of understanding that within that, while also um, treating them as an individual. Um, Kind of mentioned too a lot of his patients sees are working class, so consider the socioeconomic status and how that impacts their mental health. Just being aware of that. Um, to just being he just mentioned being aware of how political results can affect clients, just checking in and being comfortable speaking with them about that. Check what they're feeling to kind of get a pulse on that. He just, as he said, um, being comfortable with asking cultural questions and political questions. Um, and issues and ethics in the helping profession. It mentions we have to foster trust by creating a safe space, and that can include exploring the cultural and political experiences of a client. We must remain curious and empathetic to navigate these sensitive topics. And the second therapist had similar thoughts. He mentioned just how to respect culture and be aware of it. Just mentioned, everybody has a culture. If working with, or he just mentioned too, if working with a woman might, bringing up what it's like, him as a man, what it's like working with him, and just kind of, feeling free to ask the client, how am I a good fit for you? Like, and how, and um, yeah. um, and just respecting culture, just mention, we don't want to make assumptions, but just be respectful of any, like their culture, just the cultural realities for the client. He had a good example just about boundary making. That might be different for different clients, based on their culture. Um, some cultures have an emphasis on attending family functions. It can be like disrespectful not to join in these functions. So he was mentioning just, he helps clients, make sure to use the right language when having to get back to family members. And just, he mentioned on his part too, it'd be culturally like insensitive for him to assume that, if they're not standing up for their family, then they don't have good boundaries. So just making sure to, and just understanding that. And as he described, his job is to help them explore and manage their world, not the world as he sees it. So just being aware of that. Next question I asked was just about just going over licensing and regulation in the MFT profession. So they both had, similar thoughts. We just went over, or they both thought, 3,000 hours is a little daunting. It's a lot, but at the same time, Um, getting that amount of experience, it felt like it was good experience for the when it's time to for the licensure test and to just have a um, just work with a diverse range of clients. Um, just going to kind of what the second therapist went a little more in depth, um, but just licensure testing just ensures a competent therapist. Making sure to maintain licensure, stay up to date. Um, he was just going over some of the requirements he has to have. There's certain continuing education units that need to be done with the Board of Behavioral Science. Um, yeah, just looking in terms of the MFT code of ethics, just maintaining competence. Marriage and family therapists have to pursue knowledge of new developments and maintain their competence in marriage and family therapy through education, training, and/or supervised experience. Um, yeah, going more into that, second therapist attends consultation groups with three of their colleagues once a month to talk about cases and just being in private practice. Um, this also aligns just with Section 3.3 of the Code of Ethics, where marriage and family therapists pursue appropriate consultation and training to ensure adequate knowledge and adherence to applicable laws, ethics, and professional standards. And my next question was just regarding just challenges you foresee for individuals entering careers in the MFT profession. Um, so they had some similar thoughts. The first therapist, he kind of mentioned that there's an overemphasis on evidence-based practices. So just like CBT and just kind of just focus on just I think it's just he just mentioned the emphasis on the theories, and that can just and kind of having he thinks that the therapist is being seen more as a doctor's role without the personal touch. So without bringing yourself into the therapist room, and he doesn't see that as impactful. Just thinking about that myself, kind of what we learned just through our classes is like we're not just trying to fix their solutions or solve their problems like right away. It's to listen to them and to empower the clients to become the best version of themselves. I think the second therapist kind of looking at the challenges for individuals entering the career. He just mentioned too with AI, he could see AI just using evidence-based modalities and just having success with that, and they could use that instead of seeing therapists. So you can see that maybe being a challenge where AI is kind of taking some of the jobs from therapists. But he kind of mentioned, having said that, there's still that need for human contact, um, and putting a personal touch on it. Also, he mentioned just the affordability. How much will insurance, cover in the future? Will patients see more private practice therapists, over therapists in, a public hospital setting? What's that going to look like in the future? And just the future for MFTs and just the counseling field. They mentioned, it's a burgeoning field. People need a lot of help and need that personal touch, like I mentioned. Not just AI computers, but actual people. And just going off to what I mentioned, what the first therapist mentioned, relationship is what's essential instead of the theory. Just building that relationship and just bringing yourself into the therapy room as well. Um, I like how they both recommended books. I know the first therapist recommended The Gift of Therapy. It's open letter to new generation of therapists and their patients. Um, and that just kind of goes off of to bringing that personal touch to it. And then another book that the other patient or other therapist mentioned, which is 100 Years of Psychotherapy and the World's Getting Worse. By James Hillman and Michael Ventura. But just briefly looking at kind of what they're mainly talking about, but similar ideas. You know, the crucial thing is not just applying the theory or the technique, but that authenticity of the relationship between the two people in the room. Um, Therapy relies on the ability to connect genuinely, so we just want to focus on that uh, as therapists. And yeah, this allows patients to feel seen, heard, and supported in their journey. Kind of just in conclusion from from talking with the therapist, it's just to be aware of people's cultural background, but also to make sure to treat each person, as their own unique person, individual person. Um, and just, it's the therapeutic relationship itself, not just the technique. That's how we're going to have change. Um, and just that human connectedness is central to therapy. Um, just going off to what they mentioned, confidentiality. It's important to keep clients' information safe. It's important to maintain accurate record keeping to minimize, legal risks. Just upholding licensing and continuing education, will ensure therapists remain competent. And it's always good, just like the second therapist, he has consultation with therapists. That provides a level of accountability and just gaining knowledge through talking with your peers. Um, by upholding these principles, MFTs can support proper care, for all health systems that involved with the client. Um, just my personal thoughts of the future of marriage family therapy. It's a much needed field. Um, we need to be culturally competent and aware therapists. Um, I think the future is going to be challenging because of the demand for therapists. So it's important that we collaborate together and just find the way to provide best care for others. I aim to just build a therapeutic relationship with the client to provide them the best care. And just, I want to provide a space where clients are heard and feel well supported. And that concludes my presentation. Thank you.